That's right. As Em was mentioning, the FDA actually approved that vaccine, and now the CDC has also endorsed Pfizer's vaccine for children ages 12 to 15. If everything goes as planned, California State epidemiologist Dr. Erica Pan says the state's My Turn site will begin making appointments available as soon as tomorrow morning. Joining us now to talk about vaccinating children and teenagers is Dr. Lauren Crosby. She's a pediatrician and a spokeswoman for the American Academy of Pediatrics. Always great to have your guidance and advice, Dr. Crosby, especially today when the AAP also made its recommendation about those Pfizer vaccines for ages 12 to 15. So what do parents need to know about this vaccine and this guidance that the AAP is putting out?
Yes, this is such exciting news, actually. Pfizer's COVID-19 vaccine for kids ages 12 to 15 was found to be 100% effective in preventing infection. The vaccine development and process were robust. They were rigorously following all the normal safety protocols, and all who were vaccinated produced strong antibody responses and experienced no serious side effects. So the American Academy of Pediatrics does go along and recommend all eligible children get this vaccine. It's the best way to protect kids and teens from COVID-19. And we pediatricians we're hopeful kids will get it and they'll be able to get back to normal, experience all the activities that are important for their health, for their development. You know, fewer kids than adults suffered from severe disease, but it's still not benign in kids. More than 3.8 million kids were infected with the virus. Those are just the ones we know about since the beginning of the pandemic. Children have suffered in other ways with disruptions in their education, their mental and emotional health, delays in healthcare access. So vaccinating them will protect them and hopefully get them back into their normal life.
That's great news for those parents of ages 12 to 15 children. Let's speak now to those rest of those parents, like myself, who have kids under the age of 12. The CDC recently put out a guidance about outdoor masking in its summer camp guidance, essentially saying that if you can't physically distance, kids should still be wearing masks outdoors. But we're hearing so much science about outdoor masking, maybe that it's not necessarily not a lot of transmission going outdoors. What do you say to parents about outdoor masking, especially for those kids who can't get the vaccine yet?
Well, you know, we're still recommending it if they're outdoors. Masking, distancing, those are still important. So we have not felt that we're going to be telling kids, fine, you don't have to mask, because also when kids are running around and playing, it's not going to be on their mind to stay distanced. They may get close together. So at least if they have the mask on, they'll have some form of protection.
And children of all ages have fallen behind on their immunizations over the course of this pandemic, often because parents don't want to take their kids into doctors' offices, perhaps fearing that they would catch the virus there. But now there's an opportunity for these parents perhaps to get immunizations, and some of them are going in maybe for this Pfizer vaccine. What do you say? Can they get those vaccines that they've been behind on at the same time, or should they space those out?
Well, that's interesting. That's actually brand new out today. So the recommendation initially was that the COVID-19 vaccine had to be given 2 weeks apart from other vaccines. Today it was announced that it can be given at the same time, so co-administered with other vaccines. There will be more information about this soon as far as if you get one, how long do you have to wait? It's still 2 weeks, but you could get them together. It's also just a good general reminder. You should call your pediatrician, schedule a yearly physical. Many skip those checkups. Immunization rates did drop, leaves the door open for diseases like meningitis, whooping cough, measles, tetanus, deadly things. So get your child caught up on all the vaccines, call the doctor, and get in as soon as you can, get that done. Also for school and camp.
And also just a quick moment left, but what's the timeline looking like for children under the age of 12 to get vaccine approval?
Well, so Pfizer actually has begun a trial in kids under 12, starting inoculations at ages 5 to 11. And scientists plan to start testing also in even 2 to 5-year-olds,
right? And
then 6 months to 2 years. So we're thinking by September, and Moderna is starting to do the same. So they're getting there. They're a little bit behind that.
Yeah.
AstraZeneca, Johnson & Johnson
right.
also.
All those are coming down the pike. Dr. Crosby, thank you so much. And we are entering a new phase of this pandemic. It'll be great to get your guidance as we continue to go through, especially for children.